Okay, universal health coverage actually is the powerful public health tool that we hope that everyone should have access to healthcare without facing financial hardship. Next slide. So, membership, benefit package, and also financing protection. When we compare in the ASEAN countries, it is our position. Malaysia, because tax-based system, 100%, and financial protection is around 40%. So meaning that an average of Malaysian, they still have to pay around 60%. And Thailand, 90%, and that is the health service coverage. That is the number of population. So like in the WHO, concept. Indonesia, the time it was published in Lancet, 68%, now 77%. So the financial protection is around 30%. It means that the cost sharing around 30%. So 70% is protected. Philippines, Vietnam, and Laos and Cambodia. So here, if we see in the globe, United Nations Development Program, China, previously there is no universal health coverage, but developed very fast. Indonesia started in 1969, then here, and US is around here. Spain, France, Germany, South Korea also, very fast. And if we see the number of population and the GDP per person and life expectancy, so India, China, Indonesia here, then here the Indonesia now around 70, India also, China here. So we look here that the GDP per person huge here in United States is not quite different, and maybe in the future this will be almost similar. So meaning that even actually with low GDP per person, there is possibility to achieve universal coverage. Not only the rich people, but there is the life expectancy versus health expenditure over time. That is the US compared to other developed countries. So here, if we look the comparison between Obama healthcare and Trump care. So Obama, I think Indonesia actually compared to US sharing many things. We are, the population almost similar. 200, around 260. I think US also 200. Almost 300. Yeah. But we share also Obama, our president, because when he was, in his childhood in Jakarta, so after his smart, we sent it to US to develop Obama healthcare, and then we follow it to develop. We call it in Indonesia JKN Kids or BPJS. US Trump, now American healthcare here, and the plan and coverage, comprehensive. But we can see it, everything is covered, but sometimes it's not there. This is the problem. Obama healthcare, then essential benefit, but US Trump care depend on the need, especially the young. They can choose. And who are covered? Intended to cover all. Yeah, we hope that in the year 2019, all will be covered. I think Obama also like that. Because there is Medicaid extension, but here there is no Medicaid extension. Each citizen compulsory, individual mandate, so federal penalty. Here optional. Pre-existing condition, actually this has to be included. Also has to be included, but more. And US Trump care actually also has to be included, but smaller coverage. What birth premium depend on age location. Here similar, relatively similar, selective coverage, especially for the working age. Insurance carrier centralized, not for profit. Here, Obama decentralized, especially for Medicaid, state, federal. If state can, Medicaid expansion, see federal can put more money. Here, mostly are depend on the state, so federal not quite intervene. Healthcare providers, public, especially primary healthcare, referral hospital, and it is HMO like. But here, HMO and PPO, and this depend on type of plan. And payment, capitation on primary care and DRG for hospital. US already developed DRG, but not all the health facilities using DRG in US. Some fee for service and value-based payment. So preventive care, covered, more preventive focus, less preventive focus. For example, like pap smear, but I don't know for the abortion. Yeah, maybe not covered. Then here the health insurance carrier in Indonesia. The problem is again not only the membership but also the financial difficulties. We already deficit. Health facilities, we have referral system, number of primary health care and private clinics using payment. But the problem is here, health providers felt that the payment is lower than the market price. This is the problem. And this is the health facilities, number of health facilities already contacted, and this is the number of referral hospital. So this is like SMO, so should be referred. They cannot go directly to specialist or tertiary hospital. This is the benefit package of Indonesian. So pre-existing condition is covered. So there is no questions. If you already suffering from heart disease, okay, you can be included. And what is the result? Catastrophic diseases load is quite high here. So consume huge amount of money. This is the catastrophic disease again. Then of course we are facing ethical challenges. There are many challenges actually. Sustainability of the scheme, as Marijo already mentioned, deficit is increasing. So every year we increase the deficit and increasing. I do not know up to when, but because now is the almost election time, president election, if president will increase the premium, this will be very sensitive to the citizen. Payment mechanism and the tariff still below market price. Socialization empowerment is still limited. Membership, especially from the rich and informal sectors, especially the farmers, still very difficult to register to this system. Availability and quality of healthcare infrastructures, especially in remote areas. Membership, complaint resolution, management, human resources, and the clearness of the roles and tasks and responsibility of the main related stakeholders or institutions such as Ministry of Health, National Social Security Board, Health Social Security, and also the local government. So in US, for example, Medicaid, the state is very strong, but in Indonesia, local government or state is very weak for this system. They just as observer, so almost doing nothing. At least for the membership component, there are at least two problem or ethical challenges. First classification, poor and non-poor. This is very difficult, to classify. So therefore, according to Central Bureau of Statistics, the poor is only 11.5% or 27 million people. But then, because to differentiate is very difficult, whether near poor or near rich, what is the difference? Therefore, it is covered 92.3 million. So this is paid by the government.
And also sometimes, the people in the border, they like fluctuative.
Yes.
Yesterday above the line and today below the line, that kind of thing.
Because it's fragile.
It's fragile,
yeah.
It's
Right.
fragile, if you're really low.
Yes.
So you don't have just black and white there.
Yes.
It's not just poor or
Yeah.
rich. It's,
Yeah.
left, right.
So of course that is very difficult. Then, if, for example, if they are not classified, in fact they have right, or some of the stateless person do not have, card, then this again a problem. So actually they need, but they are not, administratively cannot show his right. So very difficult here. Membership, especially from the high salary employees, is only paying maximum 2 times of minimum of taxable income. So the rich, if they only pay little, limited amount of money. This is not quite fair, because the rich they pay little, and the poor they pay almost the same amount of money. The concept of solidarity, that the rich will pay more than the poor, then concept of retribution asset to be problem here.
You mean there's no solidarity?
Yeah, solidarity is there but not quite strong. Yeah. Because only pay 2 times of the non-taxable minimum income.
Well, there may be trusters.
And that is the ethical challenges for providing services. Many fraud. Of course, actually, not only Indonesia, US estimated 10% of a total health expenditure is related to fraud. I can show it, the textbook said like that. And of course, Indonesia is small, but now the anti-corruption committee is trying to enter to the health facilities. How much? And of course, there's one of the, what you call it, the chairman of region was caught by the anti-corruption committee, because some of the money should be, fully given to the health centers, and he took some percent, and then now go to the jail. Hospital room, sometimes, they said, the hospital said it's full. In fact, it is not full, because the payment of the hospital little bit lower than the market price, so they said it is full. And rare cases, especially the private hospital, ask the financial guarantee. So that is the problem, because if the patient cannot show the guarantee, financial guarantee, then the hospital do not provide services. But it is rare cases, but it occurs. And one of the baby died because of this financial guarantee, but not many. Unnecessary procedure operation, because the tariff is higher. For example, cesarean section in the normal delivery now increasing. Equity in area where they pay relatively the same premium rate, but infrastructure is availability is low. So here we can see it, the number of cesarean section is increasing. This is the critical success factor. Yeah.
So it went from
this is around 45 up to 57% only in the month. Yeah, less than a year. Sorry. Less than a year. January up to November. So increasing. Because why? Because cesarean section is more expensive, so the hospital get more money compared to the normal delivery by normal yeah.
That could also be that looks maybe could be the explanation behind the U.S. one, with this incredible increase in C-sections over the last number of years.
Yeah.
I don't know the exact rate, but it's really too high, right?
Yeah, it's too high. Yeah.
It's too high.
Yeah. It is also increasing. Maybe here, but we do not know it. But sometimes the doctor said to the young mother, so if you use cesarean section, you look like still virgin, something like that.
Oh no.
Okay. So this is the critical success factor for Indonesia. Actually, if you can say it is success, but success or not success, then we can see it. But now the problem is again, we are, have challenges. many challenges, for example, like the deficit, but leadership, political commitment, creating facility critical mass of experts and stakeholders interested in national health insurance. We still have a few people actually who are expert in this, system. Technical capacity and system design implementation, learning experience and running different schemes of the past, preparing for enhancing health structures, especially in remote area, human resources for health and health insurance, education, advocacy, and awareness of various stakeholders. This, again, a little bit problem. So our conclusion is that it is our responsibility to shape better world by implementing global commitment on sustainable development goals, especially goals number 3 and number 4 at least. So good health and well-being. So developing and implementing universal health coverage is a promising tool to achieve this goal. So everyone, everywhere should have access to quality healthcare without facing financial hardship. And as we know that there is no one size fits for all for universal coverage, therefore it depends on the country itself. So it depends on the philosophy, history, commitment, resources, capacity, and implementation of the country. US, I think, with higher resources, should be easier to achieve universal coverage compared to Indonesia. However, lower resources, again, and capacity like Indonesia should also be able to achieve universal coverage. Both in rich and poor countries, universal coverage will bring huge benefit actually, not only for health but also the economic situation. And there are many challenges in implementing and practicing the universal coverage program in Indonesia, including ethical challenges in the component of government. For example, that the government have to be, more understand of these problems and developing appropriate regulation. And health insurance carrier BPJS, especially the deficit, so it is a big challenge, and deficit is challenging. But unfortunately, the director of BPJS, director of health insurance carrier, he do not accept if it was said deficit. He always said mismatch, but I do not know what is different between mismatch and deficit. So
that's
again,
an interesting discourse.
healthcare facilities, members of all citizens of the country, there are many challenges. Appropriate strategic measures should be developed to solve and anticipate these challenges. I think that is all, and thank you very much. I'm so sorry of all